Good day everyone, I'm Pusha Maria Helga from SAS in Iloilo Batch 3. Today I will be demonstrating the process on doing range of motion exercises on a patient. What is range of motion? Range of motion exercises may be passive, active, or active assisted. It is also the movement of joints through its full range in all appropriate planes. There are three main purposes. One is for the maintenance of current joint functions. 2. Restoration of joint functions that has been lost due to disease, injury, or lack of use. And 3. Strengthening of the muscles. In doing the range of motion exercises, 4 things are needed. 1 is the BP apparatus, 2. Stethoscope, thermometer, pen and paper for recording for the contraindications. Range of motion exercises should not be performed if the joints are swollen, inflamed, or if there is injury in the musculoskeletal system. In the vicinity of the joints for the assessment, we have to assess the joint mobility and activity status of the patient. We also have to assess the general health status of the patient. We also have to assess if the patient has the ability to participate in the exercises. For the planning, we have to plan the time and type of exercises to be performed. Remember, range of motion exercises can be done once or twice a day. Next, we have to consult the physician on the client's medical diagnosis to determine whether the range of motion exercises are appropriate or contraindicated in the client's condition. Next, we have to wash hands for infection. Next, we should identify the client in order for us to ensure that we are performing the right procedure to the right plan. Good day, ma'am. I'm Prisha, your caregiver for today. May you state your name and your birthday, ma'am?
I'm Rizal Sanchanes, April 5, 1997.
Okay, great. Thank you, ma'am. So now that we have verified the information, we should ensure the privacy. Remember, range of motion exercises should be done in a quiet environment. Next, we should explain the procedure to the client in order to alleviate anxiety and fear and to encourage the client's cooperation. Okay, ma'am, I will be performing range of motion exercises. May I have your consent, please?
Okay.
Will you cooperate during the exercise?
Yes.
The following procedure that I will do preserves muscle tone and joints flexibility. So first, for the neck part, we will do the following flexion. Position your head as if looking at the toes. Next, extension. Position your head as if looking straight ahead. Next, hyperextension. Position your head as if looking at the ceiling. Next, lateral flexion. Move your head on one shoulder and then to the other. Next, lateral rotation. Move your head on a twisting motion from side to side. Again, flexion, extension, hyperextension, lateral flexion, and lateral rotation. Next, let us move on to the shoulder part of the body. So for the flexion, we will do a flexion. For the flexion, move the arm forward and overhead. For the extension, move it back to the side of the body. For the vertical abduction, swing the arm out and up. For the vertical abduction, put it downwards to the body. For the internal rotation, move the arm up and across the body. And for the external rotation, put it at the side of the body with the right angle. So again, flexion, extension, vertical abduction, vertical adduction, internal rotation, external rotation, and do it to the other side. Next, for the elbow, remember that these movements can be done in conjunction with the shoulder. We will do the flexion by copying the elbow in the hand and then bend the arm. Then for the extension, straighten the arm. Again, flexion, extension, and do it to the other side. So for the wrist, we will do the flexion by grasping the palm with one hand and supporting the elbow with another. Then bend the wrist. For the extension, straighten the wrist. For the radial deviation, move your wrist towards the thumb. For the ulnar deviation, move your wrist to the little finger. For the circumduction, rotate your wrist on a circular motion. So again, flexion, extension, radial deviation, ulnar deviation, and circumduction. And then do it to the other side. Next, for the fingers and thumb, for the flexion, bend the fingers and thumb towards the palm. For the extension, return them back to its original place. For the abduction, spread the fingers away from each other. And for the adduction, move them to a closed position. For the circumduction, move the thumb in a circular motion. For the opposition, touch each end of the finger to the end of the thumb. Again, flexion, extension, abduction, adduction, circumduction, and opposition. Next, let's move forward to the hip and knee of the patient. So first, let us remove the top linen. Excuse me, ma'am. So for the flexion, we should lift the leg and then bend the knee as far as possible towards the client's head. Next, for the extension, we should bring it back to the surface of the bed. For the abduction, let us move the leg outward the body. For the adduction, let us bring it back to the midline. For the internal rotation, let us move the leg or let us roll the leg rather inward body. For the external rotation, let us roll the leg outward the body. So again, flexion, extension, abduction, adduction, internal rotation, external rotation, and do it to the other side. Next, let us move on to the ankle. So first, we will do dorsiflexion. For the dorsiflexion, we should cup the heel and then bend the ankle towards the lower body. For the plantar flexion, we should cup the heel and then push the ankle downwards, pointing toes. For the circumduction, we should rotate the foot in the ankle in one direction and then to the other. Again, dorsiflexion, plantar flexion, and circumduction. And do it to the other side. So the movement that I just did on the ankle helps maintain ankle flexibility to prevent foot drop. Let us move on to the toes. For the toes, let us start doing flexion by pushing the toes downward. And the extension, bend the toes upward. Abduction, spread the toes away from each other. And adduction, bring it back to its closed position. Again, flexion, extension, abduction, and adduction. After doing the exercises in the lower extremities, let us return the linen. After doing the range of motion exercises, we should wash our hands to reduce the transmission of microorganisms. We should also keep the client in a comfortable position. Provide accurate data in the care of client. We should evaluate the fatigue, joint discomfort, and joint mobility. The documentation, we should document the type of exercise, and the response of the client to that exercise. That is all for the range of motion exercises.